coming up to speak with us about some of the research that have been done between Cbus and the Melbourne University is Chris Lockwood. Now, Chris, you will remember, has that magnificent head of hair with no toxic sort of chemicals in it or whatever. So we welcome Chris. There's the clicker, there's the clock. Great.
Thanks for that, John. I don't know that I'll wake up in the morning and look at my hair quite the same way again. I've still got it for the time being. Today I wanted to talk to you about a bit of research that Cbus has done in relation to our membership, take you through some of the findings there and give an idea of what the implications I think there are for us all as an industry. But first, some of you are probably asking the question, why is it that Cbus is actually involved in research of this nature? As an industry fund, we are run solely for the benefit of members, and our focus is on their best interests. And as I talked about earlier, that includes financial, physical and mental health. We also know that member wellbeing is about having a healthier workforce. And we do have a long-term commitment. Since 2006, we've been actively supporting programs across the industry aimed at producing better men's health outcomes for the sector. Suicide is something that impacts us all and something we at Cbus know firsthand as we help members and their families with insurance claims. And I'm just going to play a small video from one of our coordinators who actually works out on site with members, just to give a bit of a flavour for that.
Yeah, this member I visited on site and I could see he was a little bit depressed, sort of, you know, but maybe I should have spoken a little bit more to him because about 6 to 8 weeks later, Pete Muldeary and myself were asked to go out and visit his wife and his young child. The member had hung himself in his garage and he had everything to live, a beautiful house, beautiful wife, children, a young child who they'd struggled to conceive for a long while. They tried and just workplace depression got too much of it.
Cbus, as a fund, we are actually in a bit of a unique position. The genesis of this research came from a reasonably simple point. We realised that we were in a position to provide a deeper insight to the incidence of suicide in our industry because we do deliver life insurance to more workers in the Australian construction and building industry than anyone else. And our cover is one of the few ones that doesn't actually exclude suicide. And so effectively this gives us some big data and has enabled us to build a database that can provide meaningful insight to the incidence of suicide across our industry. Why are we actually doing the research? Essentially we are committed to working towards reducing the incidence of suicide in our industry, but to do that properly we wanted to be sure we understood not just how big the problem is, but also if we could identify any risk factors that would help identify which parts of our industry are at greatest risk. And to do that properly, of course, we thought we'd better get in the experts. So we engaged Melbourne University to put a bit of integrity behind the research that we were going to do. Their school, the University of Melbourne School of Population and Global Health. The work was headed up by a researcher known to many here today, Dr. Alison Milner. And what she actually did, and this is a reasonably dry slide, but it's worth people just having a bit of an understanding of how we actually got to the level of understanding we did on a couple of points. It was decided to look at all the insurance death claims that Cbus paid in a year to compare those claims against the what's called the National Coroner's Information Service. And that was to get an understanding of how accurately suicides actually represented at the time of claim. The NCIS, the Coroner's Information Service, is an internet-based storage and retrieval system for all cases that have gone through a coronial process, and suicides are included in that. So the point of referencing against that data was that's meant to be the gold mark in terms of actually, recognising all the suicides that have happened in the society. So we wanted to cross-reference our records against that to see what deaths that we've actually come through our insurance process should actually have been noted as suicide but weren't at the time of claim. We went back to 2008 records to ensure there'd been sufficient time for the actual coroners to complete their processes. And additionally, we had the researchers actually look through all the records from the NCIS database for the years 2001 to 2010, coding their occupation using ABS standards, as well as the industry of work, to pull out the construction industry. So to pull out those construction industry and then look at the occupations within the construction industry across all the coronial information. Two things, once we'd actually gone through that process and analysed our data, two things really stood out. One relates to the effect skill level as determined by occupation has on the incidence of suicide across our industry. We can see here that this graph shows the rates of suicide for the Australian male population for 2001 to 2010. So that's the overall population of males in Australia. Then we add in the building and construction industry data from our research. And this blue line below, so that's a lower incidence of suicide, that's actually for higher skilled occupations in the construction industry. So those in a higher skilled, this is by ABS standard mapping, higher skilled occupations, so the skilled trades and crafts, had a considerably less likelihood of being at risk of suicide compared to the overall male population, which is great. It's a positive news story in terms of actually that part of our industry. But then we add in the data for those working in the lower skilled occupations, and we see a stark difference. So that's that red line now, that's actually noticeably above the blue line. So the red line indicates those engaged in lower skilled occupations, as opposed to those working in high skilled occupations, the blue line. And you can see there that those employed as labourers or machine operators, as the category is named, they had adjusted rate of suicide of 18 per 100,000 people, and those in the skilled trades, the higher skilled occupations, had an adjusted rate of suicide of 13 per 100,000. As I say, even without the numbers, you can see a stark difference between those two lines. Not just statistically significant, but to the common man, you can actually see it. Those in the lower skilled groups are consistently at increased risk compared to higher skilled groups. Further, you can actually see there was a slight increase in suicide amongst the lower skilled jobs during the most recent 2007 recession, which is that peak in the red line there, which obviously connects directly with the story that Narelle was talking about before, and I'm sure other stories that people in the room would actually know. This finding about the difference between skill level being a significant risk factor in our industry is actually backed up by additional international research. So Alison Milner was also involved in doing what's called a meta-analysis, where they do a bit of research looking at all the research in a particular field. So looked at 34 different studies where they'd actually tried to categorise occupation to see how that plays out as a risk factor for suicide. So these are different occupational categories. This is an international standard, different to the Australian coding, but a similar concept. So different occupation classes. The higher the bar is, the greater the risk of suicide for people working in that particular occupation. There's a few that actually stand out as significantly higher, and generally speaking, those occupations in those categories are, again, the lower skilled occupations. And when we look specifically at the actual construction industry occupation categories, you can see clearly that the two bars on the right there, they represent the lower skilled occupations, and the higher skilled occupations are there in the blue bar. So again, a stark difference. So it does confirm that it's not just a one-off finding that we've actually discovered as we've gone through our data. The other thing that we realised when we actually pulled it all together was that the second key finding relates to how accurately suicide's reported. And Cbus records for 2008 indicated there were 56 confirmed suicides amongst our membership and the claims, and that there were another 79 that were subject to coronial review. But after we went through the data matching process, there were 85 confirmed coroner confirmed suicides and 11 probable suicides that the researchers identified. So from our 56 figure that we've got in our records, that's as the claims have come in, When we've gone back and looked over the research, we think that more genuinely it's likely to be 96 and probably higher again than that. There's still some inadequacies in terms of the data that we can get from the coroners. But it's a significant difference. It's clear that at the time a death claim is made, suicide as the reason for death is significantly understated by over 40%. And this highlighted to us that stigma, which is often talked about in terms of suicide, it genuinely is an issue for all of us. And it highlights some of the significant issues associated with breaking down the stigma associated with suicide, but also points to serious issues around how that stigma is impacting on workplaces across our industry. What that showed us is that suicides are happening, but they aren't openly being recognised as such at the time of death. So not only will family, colleagues and whole workplaces be impacted when a tragedy like this happens, but how much harder is it for all those impacted to deal with the tragedy if its name remains unspoken? And this is something we see in the field where the stigma of suicide affects families and workplaces. And I'll play another video now from Graham, our coordinator, just to talk about some of those experiences.
We had a lady that, a young lady, she was probably about 28 years old. Her husband passed away in 2008 and she didn't proceed with the death claim until Christmas 2013. It was just before Christmas we did it. And after talking to her and seeing the nervousness, when I had a look at the death certificate, it said death by self-harm, by suicide. And there was a real, you could see that there was a real stigma attached to it. That's why she hadn't actually claimed it, but she figured enough was enough. She had 2 young children, so she needed a bit of money to send them through school. So, and she was just worried that the claim might be denied. She didn't realise that our insurance pays under any circumstance. So there was a real stigma for the whole lot of the family and his close friends and his work colleagues. Like, I've worked on construction sites, and construction sites, we all know each other. We're all comrades, and when you hear one of our mates dies, even though he was only a workmate, somebody you work with, and side by side, it's like losing one of your own. So I've worked on sites where members have passed away through suicide and through accident, and the site's not quite the same for a long while, and it's just some people just can't handle it, and it really does impact on productivity because the guys, we're working with him one day and the next day he's gone, so it takes a while for that to go away. Just a little bit of awareness and just take care of each other. Yeah. We run the Are You OK program here once a year, and just ask a mate or something like that, you OK? Is everything all right?
So what learnings can we take from, it's not the most groundbreaking or exciting piece of research, but it is a solid piece of research from real data based on our industry. And what learnings as an industry can we take? From a prevention perspective, this study suggests that low-skilled workers in construction should be prioritised in prevention and intervention initiatives. The stigma of suicide is strong in our industry, at not only a personal level but also a workplace level. We need to reduce the stigma of suicide. By reducing the stigma of suicide through open dialogue and increased discussion and understanding, we as an industry can become better involved in the prevention of suicide and improving the lives of those affected, both at home and at work. Taking the findings of this research forward, Cbus already works with employers through our colleagues with Mates in Construction, Inco, Link, AusHelp, but also Superfriend will be up talking with us next, Deborah. We do work directly with employers and unions and associations and all of our industry partners to try and actually provide better support services across the industry, and something that we want to share this research in detail with all our partners. We've only just finalised it recently, so we'll be able to get it out to everyone, which we're looking forward to being able to do. But the one thing we do know is that working together, we know we can actually make a meaningful difference, which is why we're all in the room today. Thanks. Did anyone have any questions?
Thanks very much for your talk. Did you also estimate the cost of suicide?
It wasn't something that was formally done through this particular piece of research, but it is something that we're looking at doing. We can identify directly one cost, and that's the actual insurance claims that are paid out, and that's part of the reason why we actually engage in this. We have direct vision in terms of how much it actually costs. When insurance claims are paid, they're paid from all of us as a community, effectively. So that's something that we have vision of, but we're mindful that getting an understanding of costs overall would be a pretty powerful thing, particularly in terms of actually encouraging employers and the industry more generally to take ownership of this. So it's an interesting point. So we're definitely going to look at the bits that are close at hand and think about what's beyond that. Great.
Thanks, Chris. That's valuable work. Any research that we can get that can confirm what we already know, and that is that it's an issue, that's really valuable stuff for us. Because if you go to people who can actually fund some of these initiatives and say, I've got a hunch that things aren't right, they'll just smile at you and go away. But the work that Chris is going to present some work shortly also about trying to look at how can we actually say there's a cost here and there's cost savings when we actually prevent this is really important. That's why bringing people together is valuable.